It's 7:15. You would think that the only emergency room on the Waianae Coast would be well funded, but a civil beat investigation found that those funds have stagnated over the past 16 years. Blaze Lovell joins us now, did the research, and we're talking about the Waianae Coast Comprehensive Health Center. Blaze, how much money, how much funding are they getting at this point?
Yeah, Steve. So since 2008, their annual state subsidy for their emergency room services have stayed at about $1.4 million a year. Now, there's other health centers a lot like Waianae Comprehensive that are serving rural communities. We looked at the Hana Health Center. They've seen an increase in their subsidies. We've looked at Molokai General. They've also seen a slight increase in the money that they're getting from the state. And so to the health executives at the Waianae Center, they're seeing that and going, this is sort of one of the inequities that we're seeing in our healthcare system. Yeah,
it's an underserved community, and this is just a prime example of that. So they're now pulling money from other spots to help fund the emergency room. How does that help their overall plans and their vision as to what they wanted to do?
Right. And one thing that the health executives there wanted to point out is that, they're saying we're still a viable health center. We're not in any dire financial straits, but they are pulling other operating revenues that they could be using and that they want to use to expand some of their mental health programs, some of their trauma recovery programs, especially in light of a lot of the violent incidents that have been happening out there.
Yeah. What is the problem overall? Why aren't they getting more money?
Well, it's not totally clear. They've tried to ask the Department of Health, which manages the contract, why aren't we getting more of those funds? It sounds like the DOH, in their statement to us, they're trying to look for more data points on the exact costs of the emergency room operations.
Yeah, and to your point, and you mentioned this is, we've seen an uptick in violence. This is a community that constantly gets neglected. Obviously, this is a very important facility that serves a great amount of people. How vital is it to the people of Waianae?
Yeah, I mean, it's the only emergency room on that coast. The next closest emergency room is, at Queens West. And one of the programs that they want to expand into is these satellite clinics at schools. I talked to a clinical psychologist and a social worker who works with the keiki out there. They say they're dealing with a lot of the normal school problems like transitioning to high school or middle school, relationship issues, but they're also trying to get more culturally based programs going because they have a high population of Native Hawaiian students.
Yeah, it is a fascinating article. Anything else you want to add?
Yeah. No, it's just, it's one of the myriad of issues that we're looking into on the Westside, and, we'll keep on tackling them as they come.
Yeah, much more in it. You can read the full article on civilbeat.org or text 66866 to get their newsletter. Blaze, thank you.
Thanks, Steve.
Appreciate it. Grace, back to you.